I'm Ansley Sutton, and I give Courtney Smith permission to do this assessment on me.
Knock, knock, knock.
Come in.
Hi.
Hi.
I'm Courtney. I'm going to be your nurse today. How are you doing? How are you doing this afternoon?
I'm doing well. How about you?
I'm doing good. I'm just going to close the curtain here so we have some privacy.
Okay.
And I'm going to wash my hands real quick before we get started.
Okay, great.
I'm also going to put on some gloves to make sure we're extra protected here. Okay. Before we start, I need to verify your patient identity. Can you tell me your first and last name?
Ansley Sutton.
And what's your birthday, Miss Sutton?
July 26, 1984.
Great, thank you. Now, tell me why you're here today.
I'm just here for our annual physical.
Okay, good. Have you been experiencing any issues, or do you have any health problems you were concerned about today?
I have a history of asthma, but nothing lately.
Okay, do you take any medications at all?
I have a Proventil inhaler that I keep with me just as needed.
Okay. How often do you have to use that for the asthma?
Not too often, really just when the seasons change.
Okay.
Environmental allergies that kind of make it
Okay.
worse.
Okay, do you have any allergies that you're aware of?
Just pollen and racking.
Seasonal allergies.
Yeah.
Okay. All right. Overall, do you feel like you are in good health, fair health, poor health?
Fair.
Okay, good. I'm going to go ahead and take your vital signs, your blood pressure, and your temperature and everything. All right. Just a little. Are you comfortable? Is the temperature okay in here for you?
Yes.
Good. Sometimes these rooms get a little cold. Alright, just check your blood pressure really quickly.
Okay. Pardon my dog.
It's okay. Good. 124/78. That's a good blood pressure. And your blood pressure is pretty good usually?
Mm-hmm.
That's good. Alright, I'm going to feel your pulse here.
Okay.
Alright, pulse is 76, and it looks like you're breathing fine. Your respirations are good at 16, and you have 100% oxygen with no oxygen being used.
Good.
Do you have any shortness of breath or anything like that?
Mm-mm.
Good, good. I'm just going to write these vital signs down really quickly. Oh, let me get your temperature real quick. Okay. 98.8. Good. All right. So I'm going to just check your orientation really quickly and make sure you're alert and oriented. Can you tell me where you are right now?
I'm in the doctor's office.
Okay, good. What is the date today?
April 20th, 2015.
Good. And tell me who the current president is.
Barack Obama.
Okay, good. I'm going to go ahead and do a quick neuro assessment on you, kind of check your eyes and everything. First thing I want to do is check your vision, okay? There's the chart up on the wall, the big E on it.
Mm-hmm.
We're going to check your visual acuity. I want you to look at that chart and see what line, how far down you can read on that chart.
Okay.
And then read me those letters.
A, C, Z, B, T, E.
Good. That was 20/20 vision. That's good. You wear glasses or contacts?
Mm-mm.
Good. Well, that's good. Yeah. Oh. All right. I forgot where to put my pen light. All right. I'm gonna shine this little light in your eyes. Just make sure you're. Thank you. Make sure that everything looks okay with your pupils. Good. Good. You have good pupillary reflexes there. Can you smile for me? Good. Stick out your tongue. Good. Kind of punch your shoulders up and turn your head back and forth. Good. Okay. Good. You have good facial symmetry and everything's even, midline. That's good. All right. go ahead and check out your hearing and how your ears are doing. First thing I do is I do want to check and see how your balance is. Part of one thing your ears can do is affect your balance. So if you don't mind standing up for me, I want to see if you can stand on one foot for about 3 to 4 seconds. How you do? Okay, good. Next foot. Very good. So your balance looks pretty good. You don't have any difficulty at home with balance? Good. You can sit back down. And then this is called a tuning fork. I'm going to hit it and it's going to make some noise. I'm going to put it in 2 different spots to begin with. And I want you to listen and tell me where you hear it the loudest. Okay?
Okay.
That's number 1 and number 2.
Number 2.
Okay. I'm going to come over here. We're going to do the same thing. Ah, sorry, hit a little hard. Number 1 and number 2.
Number 2.
Okay, good. Same. This is a little different. I'm going to do the same thing, but I want you to listen as I put it right in the middle of your forehead, and I want you to tell me if you hear it differently or the same on both sides, okay?
Okay. Same.
Good. All right. Put this far away. All right. I'm going to go ahead and listen to your heart, okay?
Okay.
All right. A couple different areas I'll listen here. You can just breathe normally. Thank you. Sorry. All right, good. Your heart sounds great. And while I'm up here, I'm going to listen to your lungs, okay?
Okay.
Take a deep breath for me. And in and out every time I move my stethoscope. Okay, I'm going to sneak back here under your back and get your hair out of the way. All right, deep breath every time I put my stethoscope down, in and out. And sound good up top. Let's see how the bases of your lungs sound. 2 more. Big breath. Good. Your lungs are clear. There's no wheezing or bronchi or anything, so that's good. Let me get this stuff out of the way. Oops, sorry. Before I get you to lay down for me to do your abdomen, I do need to just kind of feel your neck here.
Okay.
I need to feel your carotid pulses. Good. I'm actually going to listen to them too to make sure I don't hear any bruits. That's just good. All right. We're going to feel your pulses in your arms as well. I'll check your radial pulse and your brachial pulse. You can see your fingers. Good. You've got good capillary refill. Oh, sorry. Your skin is nice and warm and dry. Good coloring. Look well nourished and healthy there. This arm now. Good capillary refill here. Good skin turgor. Radial pulse. Feels good. About a 2+. Brachial pulse. The same. About a 2+. Very strong. Before I get you to lay down, one more thing. Let me get you to squeeze my hands equally if you can. Very good. Excuse me, mister. It's not your turn. All right, go ahead and push my hands towards you. Pull them towards you, excuse me.
Okay.
Good, and try and push them away. Good, good. All right. And move this out of your way. Let me get you to lay down, because I'm going to do an abdominal assessment and listen to your bowel sounds and everything. It'd be easier if you're laying down. Put this away. All right, so listen to your stomach to try and hear your bowel sounds. Do you have any stomach issues? Do you have diarrhea or constipation or anything?
No, just dogs.
Just the dogs running on you? Yeah.
Roxy.
All right, Excuse me, sir. I'm gonna have to ask you to get out of the way here. Okay, you sit.
Here.
All right. So we're gonna listen first. You use the bathroom pretty regularly?
Mhm.
Good. All right, your bowel sounds are good in all 4 quadrants. They're active. I'm gonna listen to your abdominal aorta here. All right, good. That sounds normal. And I'm gonna kind of press on your stomach and palpate it a little bit. And you tell me if you feel tenderness at any point, okay?
Okay.
You feel okay?
Yep, everything's fine.
Okay, I'm gonna do it again, just a little deeper this time.
Okay.
All right?
Yep.
Good. All right, good. That's great. While you're laying there, we're gonna check your legs out. You've got pulses all up and down your legs, so I'm gonna feel them all, starting with your femoral pulses. And they feel good. And get you just a little, check your popliteal pulses under your knees. Okay. And these 2 guys on here, got your posterior tibial pulse, 2+, and your dorsalis pedis. Those are great too, 2+ as well. There's no swelling or edema to your legs or feet. That's good. And check your capillary refill here. Good. All right. And push up against my hands. Good. Push down against my hands. Very good. Okay. Any numbness in your feet or anything? Pain in your feet? Good. No wounds on the bottom of your feet? All right. Good. All right, if you want to sit up and get yourself kind of a little more comfortable, if you can. I don't know if he'll let you. Good. Okay. Get down, Rose. All right, well, everything seems pretty good, pretty normal in your assessment, so that's great. You know, with you having asthma, I definitely encourage you to carry your inhaler with you at all times, even if you don't have to use it that frequently, because with especially this time of year when the pollen acts up, if you have an asthma attack and don't have it, you're going to really wish you did. So definitely carry that with you everywhere you go. And I avoid allergens. You know, if you know that walking in a big meadow aggravates your allergies, don't do that. Again. I'd also encourage you to make sure you're drinking plenty of water and eating a healthy, balanced diet. We do like to see people get to exercise, you know, 30 minutes a day, about 5 to 6 days a week, excuse me. And do you drink or smoke? Drink alcohol?
Occasionally.
Just very sparingly? Okay. How about smoke cigarettes?
No.
Okay, good. Just wanted to make sure. I need to educate you not to do smoke if you did.
Yeah.
All right, good. Well, everything looks great here, and they'll see you out front, so reschedule your next year's assessment and checkup, okay?
Okay, great.
It was nice meeting you today.
Nice to meet you too.
Yeah, I'm going to wash my hands before I leave here. Bye-bye.
Bye.